Hello, my name is Haley Sumner and I'm a nurse practitioner student with Auburn University, and today I'm going to be walking you through a head-to-toe assessment with my patient, Ms. Janice, who's also my mother. So prior to walking into the patient's room, I will have already looked over a full set of vital signs that would have already been taken in triage, as well as a height and weight so that I can calculate a patient BMI. When I walk into the room, I'll address myself to the patient, introduce myself, I'll perform hand hygiene, and throughout this exam we're going to maintain confidentiality for the patient as well as privacy and modesty. For the purposes of this video, she's not in a gown, but in normal hospital or clinic setting she would be, so that I could assess everything. And we'll also be assessing the skin throughout this entire exam. So all of her vital signs are within normal limits. And I'm going to give you 3 words. At the end of the exam, we're going to come back to them. So I need you to remember apples, bananas, and Mickey Mouse. Okay? So first of all, when you first walk into the room, you're going to just look at a general survey of the patient. What do you see when you walk in? Do they appear to be in any distress? Which she does not. She appears to be generally healthy. She's smiling. She's pleasant. She's cooperative. Her speech is coherent and clear, and I'll be assessing that throughout the exam as I ask her questions. She's alert and answers questions appropriately. What's your name?
Janice.
Okay, and where are you at?
At the Calhoun Hospital in Blountstown, Florida.
Okay, and what year is it?
2021.
And who's the president?
President Biden.
Okay, so she's alert and oriented to person, place, time, and situation. Her skin color appears to be within normal limits, a normal skin tone, no flushing, no obvious lesions. Her height, her stature, she's shorter in stature, she's medium build, she's a senior female, but she's healthy appearing. She is in the overweight category. Her BMI calculated to 28.3. She's 5'5" and weighs about 170. Sexual development appears to be within normal limits as well. Her posture is normal, no severe slouching or anything like that. Motor activity is good. She walked into the clinic with a steady gait, and she moves all extremities freely. And she's dressed appropriate for the weather, and I don't smell her, so she has good personal hygiene also. So we're going to start with skin and nails. Again, skin appears to be normal at first glance. I also feel, for temperature and moisture, it's warm and dry. Her skin turgor is normal, and her fingernails, there's no obvious deformities noted in her fingernails. There's no clubbing, and cap refill is less than 3 seconds to upper, and I would check upper and lower extremities. And there's no bruising or anything like that noted to the extremities. So we're going to do HEENT next. We're going to start with the head and the hair. Just at first glance, she has gray hair, which is normal from aging. It appears to be evenly distributed. I don't see any bald spots or any breakage. I don't see any infestations. We're going to palpate, and I'm just palpating for symmetry and for any lumps or obvious lesions, any pain. Does that hurt?
No.
Okay. And I don't feel any step-offs or depressions or anything. So she's normocephalic, which is a normal finding. And then we're going to move to face. I'm going to just look at the face. It looks normal, looks symmetrical. I don't notice any drooping to the mouth or to the eyes. Can you smile for me? And frown. Puff out your cheeks. Raise your eyebrows. Squint your eyes. So all that is within normal limits and intact. So that's the cranial nerve 7, the facial nerve. And then we're going to do sinuses. So I'm going to palpate first. We're going to do frontal and maxillary. Any pain?
No.
Any pain?
No.
Okay. And then I'm going to illuminate them with a pen light. Okay. No swelling, no redness, no tenderness. Those are all within normal limits on those. And then TMJ, or temporal mandibular joint. Open your mouth for me. And then close. Any pain?
No.
Okay. So it closes evenly on both sides, and they're in alignment. No pain with that. No clicking noises or anything like that. And then to test the trigeminal nerve, cranial nerve 5, I'm going to have you clench your jaw really tight for me. And I do feel those masseter muscles, so that cranial nerve 5 is intact as well. Now we're going to go to lymph nodes. I'm going to feel preauricular, postauricular, occipital, posterior cervical, anterior cervical, cervical chain, and then parotid, tonsillar, submandibular, submental, and subclavian. And those are within normal limits on all of these. There's no swelling, no tenderness. They're mobile. Also to your face. Okay, so I'm going to do a little test. This is going to be sharp, and this is going to be dull. Okay, I'm going to do it to your face. I need you to close your eyes for me, and you tell me if you feel sharp or dull.
Dull. Sharp. Sharp. Dull.
Okay, good. So cranial nerve 5 is also, that's another way to check for it, and that's intact. Moving on to eyes. So she wears glasses, but just at first glance, I don't see any obvious drainage from the eyes. Her eyelids look normal, no swelling. Her sclera is white. Her cornea appears to be intact. I can visualize the iris. She's got green eyes. Her pupils are equal and round. And her conjunctiva looks normal. I don't see any cyanosis, and it's moist. And then also, I'm going to take these off for a minute, okay? Her lacrimal ducts also, is that tender?
No.
No tenderness with those, so that's all within normal limits. No swelling. And then we're going to do cranial nerve 2 to check the optic nerve. We would do a Snellen chart, visual acuity, and I would have you stand 20 feet away from the Snellen chart. You would cover one of your eyes, and you would read the smallest line that you can see before you can no longer read the letters, and that's how they would determine a visual acuity for that. And then for light reflection, we're going to do an assessment of the eyes using an ophthalmoscope, and we would expect to see, when I shine a light, I would expect to see the reflection just medially kind of toward the nasal aspect of the pupil, and I do. So I'm going to use my ophthalmoscope, and this is going to be testing actually before I do that, we're going to do the visual fields first, so I don't get messed up. This is going to be looking for extraocular movements, and this is going to be cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. And so we're going to do points of gaze, and I'm just going to have you follow my pen light, okay? Okay, and those are within normal limits. She's got good conjugate movement, no nystagmus or lid lag or anything like that. And then we're going to have a cover test. So I want you to cover one of your eyes for me. Look straight at me. Now uncover. Okay, good. So there's no deviation of that eye when she uncovers her eye, and I would do that bilaterally. So that's a normal finding. All right, and then we will do pupillary response. I'm going to shine my pen light one more time. Look at my finger. Okay, good. So your pupils are equal, they're round, and they're reactive to light, and also, with my pen light, didn't check accommodation, sorry. And they are reactive to accommodation as well. Next, we're going to do a confrontation test. So I'm going to stand here, I'm going to cover this eye, and you cover your left eye. And I want you to tell me when you see my hands come into your visual field. Now. 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 Okay, and I would do that bilaterally as well. And then with the ophthalmoscope, I'm going to inspect the lens and retina with that. I'm going to be looking for certain anatomical properties of the eye, and we're going to be looking for the fundus, the optic disc, the retinal background, the blood vessels, the macula, and the fovea centralis. Okay? Dial it. Start at 0. All right. All right, and that is all within normal limits, and I would do that bilaterally as well. All right, and then we're going to move on to the ears. So just at first glance of the ear, it looks normal. I don't see any obvious deformities. I don't see any active drainage or anything. Do you have any pain when I move your ear? Tragus, no pain? No. Okay, so that's normal findings with just looking. We're going to do a whisper test next. I'm going to have you close your right ear, and I'm going to whisper something to you. I want you to tell me what I say.
1, 2, 3.
Okay, and I would do the same thing to the other side, and that's no deficits noted there. And then we're going to have the otoscope. We're going to look into the inner ear and the structures also. We'll do this ear first. Okay, and then I would do the same thing to the other side. And when I'm looking at that, I do see some, just a small amount of honey-colored serum. It's normal. There's no foreign bodies, there's no redness, no swelling, no bleeding or active drainage. And then I see the tympanic membrane. It's a pearly gray color. It's shiny. I saw the cone of light at approximately 5 or 6 o'clock. And beyond the tympanic membrane, I can see the outline of the malleus and the incus bones. And so next we're going to use my tuning fork. We're going to do the Weber and the Rhine test. So the Weber test, I'm going to put this on top of your head, and this is just checking to see if if you hear the same in both ears. Okay? Do you hear it the same?
Yes.
Okay, so that's normal. And then that's we're also going to do conduction by doing the Rhine test. So I'm going to put it behind your ear on your mastoid process, and I want you to tell me when you stop hearing it, and then I'm going to put it in front of your ear, and you tell me when you stop hearing it.
It stopped.
Okay, stop hear it.
Yes.
Okay, so that's normal conduction because the air conduction is longer than bone, so that's a normal finding. We're going to move on to the nose. I don't see any obvious drainage, no obvious like deformation, abnormalities, no deformities, sorry, I lost the word. And her septum appears to be midline as I'm looking at it. Move it. Any pain?
No.
Okay, so no pain or tenderness. It's movable. And then we're going to look. I don't see any obvious foreign bodies. I don't see any drainage. Turbinates are pink, moist, some clear drainage, but nothing terrible. So that's the normal findings. And then we're going to do, we're going to kind of do two things at once. I'm going to have you smell something. I'm going to have you cover one side of your nose. Okay, and close your eyes. And I want you to tell me what you smell.
Alcohol.
Okay, now cover the other side. You smell?
Alcohol.
Okay, so there's no occlusions in either side, and that was also checking the olfactory nerve, cranial nerve 1, and she can smell, so that's intact as well. Now the throat. We're going to look into your throat. With your mouth. Okay, so I see mucous membranes are moist and pink. I don't see any obvious lesions. I saw her tonsils. They're not enlarged. There's no exudates. Her lips look normal. They're not cracked or they're not super dry. She's down some lipstick. But mucous membranes are moist. Her buccal mucosa is normal. Dentation is good. You don't wear dentures.
No.
I didn't see any dental caries. I didn't see any abscesses, any gum irritation or bleeding. Her palate is intact, so there's no cleft palate. And her soft palate and her uvula both are midline. They both rise when she says ah. And so that's a normal finding. The tongue is pink and moist. There's no lesions. Lift your tongue up for me. Up. Okay, good. So I see the Stinson's and the sublingual ducts visualized as well. She doesn't have any missing teeth or anything obvious there. And tongue movement, she just moved it up and down, move it side to side for me. Okay, so that's cranial nerve 12. That's hypoglossal, and that's for tongue movement and deviations left and right, so that's intact. Also, again, cranial nerve 9, when she said ah and her uvula and soft palate raised up, that's testing for cranial nerve 9, the glossopharyngeal cranial nerve. I'm not going to stimulate a gag reflex just for the purposes of not having to do that to you, but I would take a tongue depressor and press down on her tongue and stimulate a gag reflex to make sure that the vagus nerve, cranial nerve 10, is intact. Tonsils, already said pharynx and tonsils, they're normal. And then neck. So her neck appears to be normal. I don't see any scars, any lesions, any rashes. I would check carotid pulses. Hers are +2. Check bilaterally. I would also listen with my stethoscope for any bruits. And then we're going to palpate thyroid. I do it from the front sometimes, but I like to do it from the back. I'll get back here. This bed is big. All right, swallow for me. Okay, so it does rise when she swallows, which is a normal finding. I didn't feel any nodules. I didn't feel a goiter. You can also have her look forward and kind of press the trachea over to one side and feel for nodules. So that was all within normal limits. Move your neck down and back. Move it this way against my hand. That way against my hand. And turn. Okay, she's got normal range of motion in her neck. Can you raise, show your shoulders for me? Good. and she can move her shoulders and her head against some resistance, and so that's checking for cranial nerve 11, which is the spinal accessory nerve, and that's intact as well. Her trachea appears to be midline. There's no deviations, and her neck was non-tender when I checked. And then the portion that was assigned to me, in addition to the HE/ENT, was neuro. I've already assessed a lot of the cranial nerves throughout the assessment. There's just a few more tests and we're almost done. So again, she is conscious, she's alert, and oriented ×4. She told me her name, where she's at, the year, and the situation. She told us who the president was. There's no cognitive impairment noted. She's followed all my commands throughout the exam. So recent memory, we're going to check. Do you remember the 3 words that I gave you in the beginning?
Apples, bananas, and Mickey Mouse.
Okay, so she's got recent memory intact. Now, where did you go last spring break last year?
I did not go anywhere on spring break.
So her remote memory is intact as well. And then we're going to check some deep tendon reflexes. So I'm going to check the brachial. Just relax your arm on mine. Okay, and then we're going to check brachioradialis. Okay, and then you're going to relax it right here. Just loosey-goosey.
Ting.
There you go. Okay. And then we're going to do the patellar. Just hang your legs, relax them for me. Okay, and then Achilles. Okay. And then I would also check the Bensky, stroke the plantar portion of the foot. And her foot did not fan out, so that is a normal finding of Babinski. Did I do your bicep? I do your bicep. I did bicep and brachioradialis. Okay, so then we're going to do stereogenesis. I'm going to give you a really common object. I need you to close your eyes, and you just tell me what it is. Okay?
A pen.
Okay, so that's intact. That's normal. She was able to recognize that with her eyes closed. And then we're going to do graphesthesia. I can't say it. When you do something in their hand, you draw something in their hand, and they know what it is. Graphesthesia or something, I think. So close your eyes, hold out your hand, and you tell me what I'm drawing in your hand.
S.
Okay, so she was able to recognize that. Sensation, I know we already did that to your face, but we're going to do the sharp and dull also to your upper and lower extremities. Okay, so close your eyes, tell me sharp or dull.
Dull. Sharp. Sharp. Dull.
Okay, and I would do that bilaterally to the other side as well. And then cerebellar motor function. Do you like this for me? Okay, fine motor is intact. And touch your nose and touch my finger. Keep doing it. Go faster, fast as you can. Okay, so rapid movements are normal. The accuracy of her movement is normal, and her fine motor function is within normal limits. Stand up for me. I'm going to have you walk heel to toe for me. Okay, that's good, and that's within normal limits also. All right, and then stand with your hands right here. I mean, not your hands, your feet at shoulder width apart, and then close your eyes. Okay, good. So that's Romberg test, and that is normal. She didn't sway or anything like that. And then hop up and down for me. Okay, good. So that is just testing motor function as well. All right, sit down. I think that's everything. I think that's everything. I did your eyes, I did your ears. The eyes, I don't know. I didn't verbalize exactly what I saw in the eye, I don't think. When I looked in the eye, the retinal background, I didn't see any hemorrhages, I didn't see any exudates, no narrowing of the vessels or anything. Her optic disc was round, it was yellowish, orangish color, and it had defined borders, if I didn't say that before. So, and that concludes the head-to-toe assessment. Thank you for your time.